Welcome to another edition of the Patient Attraction Podcast. This is Colin, receiver, and I'm really excited about today. I've got the world's most famous hygienist here with me today, Wendy Briggs. Welcome on the board.
Hey, thanks for having me, Colin. I don't know that I'd say the world's most famous hygienist, but hey, you're probably quoting someone there.
Well, might be. You've been said somewhere. I read that. Now, if you don't know Wendy, she's a highly productive practicing hygienist, strategic advisor to thousands of dentists, speaker, trainer, consultant, coach. She's worked with somewhere around 4,000 practices in 12 countries around the world. And her claim to fame is doubling your hygiene production. So I'm excited to dive into this a little bit. This is new territory for me. I haven't been in the hygiene side a lot. I know we have a lot of practices that we see a lot of issues in their hygiene, whether it's symptoms or actual problems that come back to hygiene. So I'm excited to dive in here and talk about this a little bit and see what your take on some of this is.
Wow, thanks so much for having me. We love talking about all things practice growth, and hygiene such a big part of that.
Mm-hmm. I think there's a lot of practices that they look at hygiene and it's almost like they have to do it, like they can't get rid of it. Or they look at hygiene and it's a loss leader. What's your take on that? I'm sure you see that a lot in your day-to-day business.
Yeah, and I think it's a very common frustration that we hear that dentists are frustrated with hygienists. Hygienists kind of get a little bit of a bad rap, whether it's deserved or not. Sometimes it probably is, sometimes probably not, as being difficult to deal with. We tend to want to do things our own way, right? And the whole loss leader thing really is an outdated paradigm. The thinking used to be get patients in the door through hygiene and then sell them on restorative. It doesn't matter if hygiene is profitable. And while I understand that thinking, we have found the exact opposite to be true. Certainly, it's true that a good percentage of the restorative treatment is referred from hygiene, so it is critically important. But in my mind, if the hygiene department isn't profitable, we're missing some very valuable opportunities. So I perceive, I prefer to think of hygiene as a big opportunity in many practices. And what's so exciting about that to me is that very rarely do we have systems in place or have we made much effort at all to maximize that opportunity. So this is something that when we go in, we've got now 20 years of knowledge and training and systems, and verbal skills that can really revolutionize hygiene departments. And so when we go in, it is often like flipping a switch. And from 1 month to the next, we do see practices literally double their hygiene department. Sometimes it's even more than that, depending on where they are at the beginning.
That's awesome. I mean, who wouldn't like to double? But let's dive into that a little bit. What do you see? The questions I get all the time: how much time do you schedule for hygiene appointments? Do you have broken appointments, no-show problems? Are there declines in direct referrals? How does all this stuff work together? I think that a little bit the loss leader is a little bit of the symptom of the problem. Where does the real problem lie, and how are all these things related?
Yeah, it's a really great question. So there's a couple different tracks we could take in talking about that. The first thing I'm going to talk about is no-shows, open time cancellations, and hygiene, and how that sometimes, pushes us to think about shortening the appointment times down for hygienists. Mm-hmm. And in reality, what we see in the long run, when that strategy is embraced, is the practice shrinking over time rather than growing. So let me explain what I mean by that. There's a lot of people that think, oh gosh, we need to increase hygiene revenue. We need to see a productivity increase. Hygiene isn't profitable. We're losing money. Mm-hmm. And so the first thing they do is they shorten the appointments times down. When in reality, when production is struggling in hygiene, often it's because we don't have enough time to do additional ancillary procedures. So same day preventative procedures aren't happening. And when we look at what really fuels practice growth and how we tactically go about doubling hygiene, those procedures are critically important. So when we shorten the appointment times down, 45 minutes, 30 minutes, even today, that's a trend. Some people might think, well, gosh, that's not possible. But we see it in practices across the country that they're shortening those appointments down to 30 minutes time. And, I'm here to tell you that you're going to have a high level of churn. The first things you'll most likely lose is your hygiene providers. And ultimately, patient retention is directly tied to staff retention. So eventually you end up losing your patients. Nobody can feel good about the quality of care they're providing in a 30-minute appointment. Mm-hmm. So when we talk about doubling your hygiene production, Colin, there's probably dentists and hygienists listening to the podcast that think, oh gosh, that's not possible. Sounds too good to be true. I'm already busy. I'm running around with my hair on fire. I can't do any more. And just like in a lot of industries, the lesson is not to work harder, it is to work smarter. And I know that sounds like a trite phrase and something that doesn't really carry a lot of meaning, but in our world, it certainly does. So when we have that patient come in, if we have a 50 or 60-minute appointment time, we teach people how to utilize a structure called the anatomy of an appointment. And what we do is we break down that appointment into 3 segments. And when we shorten appointments down to 30 or 45 minutes, we're allowing time for the diagnostic and data gathering. We're allowing time for the hygiene phase, but we're really not allowing time for same-day services. And that's what really can transform a practice with profitability, is to allow for those additional same-day services to be performed during hygiene. So when it comes to the scheduling side of it, no-shows, cancellations, open time can be a frustration. But don't fall into thinking that the solution to that is to shorten the appointment times down, because what we've seen in the long run is it actually makes the problem worse. So when we have a high level of open time in hygiene, really what we need to look at is systems. We find that it's almost always a systems failure. And we teach what we call 7 R's for profitable hygiene. These are all the systems that are necessary to keep the hygiene schedule full and productive. And those systems, those 7 R's are recall, recovery, reactivation, retention, referrals, reviews, reappointments. All of those R's drive profitability and effectiveness in the hygiene chair. Mm-hmm. So usually when we find a lot of open time cancellations, no-shows, we aren't fully utilizing systems for recovery, for example, systems for recall, systems for reactivation. There's probably a systems failure somewhere along the line that's causing that.
Mm-hmm. Oh yeah. Yeah. I think when the systems fail, that's when our hair gets set on fire. And that's when we feel like we're so much busier than we need to be. I mean, the hygienists, dentists, doctors, nobody in the world, I don't think, operates at less than they feel their ceiling is. We all operate at the highest level that we believe is possible. And it's only when you can break through that ceiling and realize, oh, there's this new system, or there's this new process, or there's this new way of doing things that can actually make it better, do you realize how much gain you can pick up, right? Does that make sense?
Right, absolutely. And so there's certainly things that we teach that can increase efficiency in the appointment, but we still find, world-class hygiene departments need 50 or 60 minutes to really provide what we call a world-class level of care. Now, certainly there are practices out there that have less time, but it's usually an adaptive strategy. So it's not necessarily the time in the hygiene chair. There's other things happening. There may be more than one column of appointment scheduled. There may be more than one provider helping to see to the needs of those patients. So right here, we're talking about a traditional model of hygiene. An assisted model is completely different. I would say we teach, 4 to 5 different processes when it comes to hygiene scheduling and number of appointment times. So certainly, Colin, I would say, I don't want your listeners to think there's a one-size-fits-all answer for this. But when it comes to world-class hygiene and really maximizing potential for treatment, we find the current trend of slashing hygiene appointments to 30 or 40 minutes is alarming.
Mm-hmm. What are the 3 roles? I've heard you talk about this before, but I've never really dove into it. You've talked about 3 roles of hygienist. What are those, and how do they work together?
Well, certainly there's many roles that hygienists fulfill every day. But when we look at a world-class hygiene department and try and identify what they do differently than the masses, we find that they've maximized systems and processes and skills in three distinct categories. The first is the role of a preventive therapist. So preventive therapists do everything that happens in the day-to-day of the appointment, certainly cleanings and all of that, but they also are maximizing preventative services. And the way that they do that is by taking the initiative and doing a risk assessment on their patients, making sure that the services on our preventive menu, like fluoride and sealants and desensitizing agents, take-home products that can help the patients win in their battle against disease. All of these services fit under that category, preventive therapy. And one thing I can say is our roles in that category are changing and shifting the more we learn about the etiology of disease. And the more we understand that just because a patient has always struggled with cavities doesn't mean they always will. We know what to do to help turn that around for them. Hygienists that really maximize their role as a preventive therapist are making sure patients are educated at the highest level, really understand what they can do and how they can do it to really turn around and create a new future for them when it comes to their health in their mouth. So that's the first role, preventive therapy. Then we move into the periodontal therapist role. This is something that I would say most practices struggle with this. I have the distinct honor of being a consulting partner for Henry Schein Dental. There's only 2 consultants in the entire country that they list as their consulting partners. And we are one of those partners, and we're considered the hygiene experts, right? So when we look at a Henry Schein practice analysis, almost always we see big opportunity in the role of a periodontal therapist. And we look at, 1,000, 1,500 of those a year. So the data doesn't lie. I would also say that Dentistry Today published an article that said only 3% of all the codes we utilize in dentistry are in that periodontal therapist category. So in the 4,000 category, which tells me as a profession, as an industry, we've got some work to do here. And I think the reason that we don't perform very well in this area, it's a multifaceted reason, in my opinion. When we look at one area, it's highly complex, it's difficult, it's confusing. The AAP just changed the classifications yet again. Even though as a profession we're performing horribly in this area, they're adding another level of complexity to it. So that's frustrating to me, because it's difficult for those in the trenches to really keep up with those changes and know how to adapt and adjust. But I think another challenging issue is helping patients understand why they need what they need, and that this is actually a diagnosis of a disease. Patients get stuck on what their insurance covers, or we actually sometimes are the ones that are stuck on what their insurance covers. And so I think really focusing in and spending time working on our personal presentation skills when it comes to discussing periodontal therapy opens a big doorway of opportunity for many hygienists that we work with. So complexity is a problem. When patients are confused, they can't move forward, they actually become paralyzed. And then also what we see in many practices is that it's a gray area to begin with. And so sometimes a hygienist becomes paralyzed. They don't know exactly what to recommend. They know it's not quite a prophy, but they also know it's not quite perio. So they don't really do anything different. There's a lot of practices doing bloody prophies all day long and really not getting paid for the skills that they're utilizing. And I think that that's wrong. I think we really should be getting paid, compensated fairly for the services we're providing.
Well, if you're providing value, definitely.
Yeah. So, there's a lot of practices that are doing perio. They're just not coding it and getting paid for it.
Yeah.
So then the third role is one that most of the dentists get super excited about. And that's because we rarely discuss this as an industry, but this is the role of the hygienist as what I call a patient treatment advocate. This is where the hygienist and the dentist partner together to help the patient understand the restorative needs that they have. We often see practices that have intraoral cameras, cavity detecting lasers, digital scanning technology that sits and doesn't get utilized in a systematic way. And in my mind, this is what the hygienist does in this role. Now, to be fair, if we have a 30-minute appointment or a 40-minute appointment, what's that expression that they say? Ain't nobody got time for that, right? If the hygienist only has that much time, one of the first things to go is utilizing the intraoral camera, having discussions about restorative. But in my mind, this is a really critical role. And we've seen practices that focus on this partnership just radically transform acceptance. And the exciting thing for me here, Colin, is, your job is to help drive new patients to the practice. And I kind of view it as our job is to help the hygiene team maximize every single patient that walks through the door, not just the new patients, but the returning patients as well. So when we focus on this role, we really are able to maximize the opportunity from every patient in the chair. We're not talking about treatment planning or talking about unnecessary dentistry here. Many practices have literally millions of dollars in the unscheduled treatment report that we pull for them in their practice. And honestly, that's what this role helps us prevent, is millions of dollars in unscheduled treatment. We're having higher level conversations with patients. We're utilizing technology at the highest level. We're actually simplifying our conversations, teaching a strategy for tribal language so the dentist and hygienist can communicate at the same level on the same page about ideal care based on each individual doctor's philosophy. So this is a critical role too, and the dentists typically get excited about this because this is what fills their schedule.
Yeah, I mean, ultimately that's all team alignment, right? I mean, that's getting aligned with your people, understanding and all being on the same page and pushing towards the same goals.
Yep, that's exactly what that is. And it's stunning to me, hygienists, that's a big part of what we do, right? 70% of all restorative is referred from hygiene, but I'll have a room full of hygienists. A couple of years ago at the ADA meeting, I had about 900 hygienists in the room, and I said, how many of you had a college level course during hygiene school that prepared you to discuss restorative treatment? And there wasn't a hand that went up. It's just a tremendous gap in our profession, in my opinion. And it is a source of frustration. In fact, I saw a social media post this week where the hygienist and the doctor were at odds, and the hygienist had been made to look a fool in front of the patient. And so she just walked out, left the office. And she'd worked there for 15 years. So it's a problem. It's a problem in many practices if they don't have the systems in place. And it's a tremendous opportunity when they know what systems to implement and we actually work on it.
Yeah. So what are some of the red flags that you see when you're looking at a practice? What are the big things that stand out that you go, aha, there's so much opportunity here that we can move the needle for this doctor if this one metric or this one number was only this much better? What are you looking for when you're walking into a practice and analyzing?
Yeah, that's such a great question, Colin. So we actually can generate a report. We call it a roadmap, a practice roadmap. And we get about 10 procedure codes really from a practice, and we plug that into an Excel sheet. And we've over the years learned how much we can turn these little knobs, right? So on the preventative side, we're going to look at preventive opportunities, and we just look at 3 procedures in that category. If we can get fluoride acceptance on adults to 80%, if we can get sealants utilized at a very low threshold, about 5% utilization, and if we can do some desensitizing or brush and bond or some type of bonded desensitizer on patients that are high risk for decay, that have root exposure, we'll look at just a handful of procedures. And it's not uncommon for us to realize, okay, if we move the needle just this much in this way, I usually teach those 3 ways to get hygiene increased by about $129,000 a year. That's just 3 preventative services. So then we also, we look at periodontal therapy. And sometimes it's just a small, subtle tweak there. We'll look at 3 or 4 procedure codes in that category. And we can actually give a practice a really clear picture of where they can go based on where they are now. So we also will look at the role of patient treatment advocate. And when we pull that roadmap, 8 to 10 procedure codes, we can generate that roadmap, and we'll be able to tell a practice, our best estimate is in the next 12 months, we've got, $350,000 easy increase or whatever it may be. So, we tend to look at the opportunities in each one of those categories. And we have a fairly simplified way to do that. One of the things that I would say is the easiest to change, you heard me mention it, fluoride on adults, super easy to change if we actually have the right tools. So we teach the hygienists, for example, how to do a risk assessment, how to have a risk assessment conversation. We teach them a 3-step process to present fluoride as an opportunity to the adults, especially those that are high risk. And we can take a hygienist that's in the negative, which means they're not even getting all the kids to do it, and get them to an 80% acceptance rate very, very quickly. And the reason we can do that is, again, 20 years in the trenches developing these systems and learning what works, that's scalable, and creating systems that work in any practice, shape or size, right? It could be a solo doctor, one hygienist, or it could be a multi-doctor, multi-hygienist. It could be multiple locations. We work from super small locations clear up to our largest entity has more than 900 locations. So these systems are proven to work across the board in all practice shapes and sizes. So again, we just look at some small and simple things that we can change. And we give the hygienist the tools and the skills, the verbal skills, to know why we should talk about these things. So we lead very heavily with the science. And then we talk about what to change in their unique practice. And then we go into how to actually do it. So there's a lot of people that will tell hygienists what we should be doing. But what most hygienists are missing is the how. And so once we bring that, that's how we see practices double their hygiene production. They're not doubling their hygiene production because they're increasing the number of patients they see every day necessarily. They're doubling their hygiene production because they are able to do more on the patients they're serving, because we've opened the door to additional opportunities that exist, driven very strongly by science.
That roadmap and that analysis sounds absolutely amazing. How much do you charge if we have clients that are interested in that? How much do you charge to do that for a practice?
Yeah, that's a really good question. If they were to go and just purchase it on the website, it's a couple $1,000s, right? Because not only do we generate the roadmap, we take the time to actually gather the data, input the numbers into the roadmap, but then we actually have a member of our team do a call, about an hour's time call, where we walk the member through that. But I will tell you that we actually have an offer right now for people who go online and get a copy of our book. There's a certificate in that book for a free roadmap, for a free practice analysis. So we just happen to have that. And of course, we'd love to extend that offer to your listeners, Colin, because we love working with your people. So essentially, if they have a book, it's free.
Wow. And how do they get a copy of this book? If that's free, everybody's going to want a copy of the book. How can they get a copy of it?
Yeah, well, and again, for listening to your podcast, we kind of have a special deal going right now. I don't know how long it'll last, but I'm hoping it'll last long enough for your listeners to take advantage of it. They can go to wendysfreebook.com. So WENDYSFREE book.com. And when they go there, they just have to register, and we'll gladly send them a book, and they can obviously learn more about the 3 roles of hygiene and how we help practices grow. But also, as I mentioned before, in the back of the book, there's a certificate for a free roadmap or practice analysis for them. So they can go to that landing page, wendysfreebook.com, click there, and get a copy of the book for free.
That's awesome. Awesome. I'm sure I know a few doctors that will really want to jump in on that, and that I appreciate you extending that to our listeners here. I know that'll be really enticing. Any other great pieces of wisdom, or if they want to learn more about you, how can they get a hold of you, or how can they get in touch with you?
Well, certainly they can go to our website. The teamtraininginstitute.com is a great place to start. We actually have a lot of amazing information there. We have a virtual membership that they can sign up for that does a lot of training and has a lot of training videos for them on that site, so they can get information there. They could also call our office if that is something that they would rather do. Some people they'd rather pick up the phone and call, and that phone number is there on the website as well. So the teamtraininginstitute.com is the place to go to connect with us and find out a little bit more about how we help practices grow, especially on the hygiene side.
Awesome. That is great. Thanks for dropping in here, Wendy. I appreciate the offer, wendysfreebook.com, if you want to reach out and grab a copy of the book. And then, of course, the roadmap and code analysis I think I know a couple doctors that would be interested in adding 600,000 to their collections in production this year. So that almost sounds too good to be true. If I hadn't seen some of the results that you've been able to generate here with your systems and processes, Wendy, I'd probably call BS on that. But I've seen you actually do it. So jump out there, take advantage of that, and join us for another episode coming soon. Thanks, Wendy, for hopping on here. I appreciate your time.
Okay. Thanks so much for having me, Colin. It was a pleasure.